by this time tuberculosis is supposed to be out, like we should have forgotten about tuberculosis.
True.
But we are seeing that there is resistance to the drugs that are being used in the treatment of tuberculosis. So time is going. That's why we have something like the clock is ticking. Like we are running behind time.
Oh, okay.
Yes.
So what is tuberculosis? Because the only thing I know about tuberculosis is that when you cough too much or you cough, well, as a layman, that's the understanding I have. You know, when you cough on yourself, you're like, you have TB, you have TB. So what is tuberculosis exactly?
Okay, like you said, everybody will say when you are coughing, that you cough too much, that's tuberculosis. But it's not all cough that it's actually tuberculosis.
Oh, okay.
You understand? Like, the major symptoms is coughing, but you need to actually carry some tests before you are sure that it is tuberculosis. Yes.
Oh, okay.
Tuberculosis is actually caused by a bacteria. It's a bacterial infection, and it's called Mycobacterium tuberculosis. You get that is what causes the tuberculosis itself. So it's an infection and it's airborne. So we get it from the hair. So when you cough, the bacteria is in the hair, and anybody that comes in contact with it.
Okay.
Yes.
Is that the only symptoms, coughing?
No, coughing is not the only symptoms. Like there's always fatigue, there's weight loss, there's sweating, and things like that.
Okay. Now you were talking about the drugs administered to cure it. You said by now we shouldn't be talking about tuberculosis. What is the reason? Why is it so?
The thing is, like I said, resistance is the major issue with it. And what causes resistance is some people, because tuberculosis drug is for like 6 months, some for a year, depending on what your doctor says you should use it, how you should use it. You get. So some people, they are not compliant with this drug. And once you are not compliant, resistance can set in. And once, like, someone has tuberculosis, is not compliant with his drug, resistance sets in, and he now infects another person. The person would actually have the bacteria that is resistant to those drugs. So by the time you are treating the new person also, the person is actually resistant to that same drug the initial person was resistant to.
So take us through this the process. So when you start seeing the symptoms, where do you go to? How do you go about it?
When you start seeing the symptoms, majorly coughing, and when you see the you have sputum and there's blood in your sputum.
Okay.
So by the time you see those ones, just go to the best thing is go to the hospital, go see your doctor.
Okay.
Your doctor would actually tell you some tests to carry out. The test they do, we have the skin test.
Okay.
Like in the skin test, a thing is injected in underneath your skin.
Okay.
It's like, will I call it like something like tuberculosis, but not tuberculosis. So the reaction that happens between your body and what was injected, there's a reading that will be taken after 3 days.
Okay.
So the reading is what determines your if you have tuberculosis or not. But the reading of that skin test does not actually satisfy that you have tuberculosis, because some comes as false negative, some comes as false positive. So the next thing they do is the X-ray, the chest X-ray. By the time they do the chest X-ray, from the chest X-ray, they get to see the bacteria, like the patches on the chest. You understand? So that is how they know if you have tuberculosis or not. But the doctor still needs to determine, after knowing if you have tuberculosis or not, the doctor actually needs to determine if you would need drug or not. Some people don't take drug because we have 2 types of the tuberculosis infection. We have the active and the latent. The active is the people that can infect other people. So those are the people that really need the drug. For the latent, they don't even have symptoms. They are not even aware they have tuberculosis. They are just being monitored so that it doesn't become active in them, so they don't spread it to other people. So that is how.
Talking about the drugs and which is used to cure tuberculosis, is it easily available? Can you get it in your pharmacy?
Well, actually, there are some centers that the government already put in place that you go to. Your doctor will actually refer you to those places to get those drugs. You understand? So they because some of the drugs, there's something they call daily. They take it daily. So
Okay.
they have to do daily observation for them because some people don't comply with the drugs. So it's when they see that okay, these people they are complying with their drug,
Okay.
that is when they actually
Okay.
give them to go and take it at
Take it
home.
at home.
Yes. So we have government hospitals where you can go to and get your
Get
daily
the
drugs.
Okay.
Yes, the only thing you get from maybe pharmacies, because some of the factors that actually, let me say, makes tuberculosis to thrive more in people is when they have weakened immune system.
Oh, okay.
Yes, so if your immune system is strong, immune system is more like a soldier in your body that is fighting.
Okay.
So
Okay.
for you to have a very strong immune
Immune
system,
system.
you need to take multivitamins.
Multivitamins,
So in the
okay.
pharmacy, you can get the multivitamins to take.
Okay, you can get the multivitamins
Yes.
in pharmacies.
Yes.
Okay.
But for the drugs for tuberculosis, you need to go to those centers.
To the centers.
Yes, I'm aware there's one in UCH.
Okay.
There's another one at Ikiwe. Even
Oh, okay.
tuberculosis center is at
Center.
Ikiwe. Yes.
Oh, okay.
Yes.
So today is World Tuberculosis Day. Any final word that you want to give our listeners out there? Advice on how to properly take care of themselves.
Well, what I would say to people is, it's not all cough that
is
is
TB.
tuberculosis.
Thank you for
Because-
emphasizing on that. Yeah.
Because everybody just thinks cough, tuberculosis, and to our mothers there, coffee. That's what they call
Yeah,
tuberculosis. Coffee. You should go call the coffee. You get, so let us just know. And this time that there's COVID, symptoms of COVID too is coughing, so we should know which is which. Then we should not stay in crowded areas. Because even tuberculosis can be gotten from crowded areas where you have someone that has the tuberculosis. We should not stay, and let us strengthen our immune system.
I think that is even one of the most important things, strengthening your immune system by getting multivitamins from pharmacies all around. Okay. The numbers to call in for consultation, if you have TB or what you see the symptoms are 0904 084 1545. I take that again, 0904 084 1545. And the other number is 0904 084 1542. 0904 084 1542. You can call those numbers for consultation if you started seeing the symptoms or the signs thereabout. Thank you so much for coming on the program today. I've been speaking with Mrs. Adeleye Olola. She's superintendent pharmacist at RXGO Pharmacy, that's located at Iana Church, also located at the mall.
Dugbe Mall
and Orogun. Thank you very much for your time. Thank you very much.
Thank you.
All right, till next time I come your way, I remain Adedapo Akin.